So we're gonna be talking about ARI transmission and symptoms. Okay, so introduction. Introduction. What is an ARI? An ARI is an acute respiratory infection. It is an infection that interferes with normal breathing. It occurs in the respiratory system. ARIs can be very serious for children under the age of 5. So the purpose of our toolkit is to bring awareness to symptoms of ARIs to the children under 5 and their families. And this is our team. I'm Michael Rosenberg.
I'm Rebecca Pan.
I'm Tabishi Kumar.
I'm Amari Harrelson.
I'm Lania Morris.
I'm Nathan.
I'm Unity Bridges.
All right. Causes and transmission.
Etiology and risk factors. The causes of ARI mostly consist of viral and bacterial infections that enters through your respiratory system. Some common illnesses related to the viral infections are the colds, influenza, or coronavirus. Regarding bacterial ARIs, common illnesses such as pneumococcal disease and meningitis exist. The 5 main factors are gender, genetics, environment, age, and behavior lifestyle. Regarding gender, females are more susceptible to upper respiratory tract infections and males susceptible to the lower ones. Genetics such as poor immune systems, heart disease, and other lung problems would also increase your susceptibility to ARIs. The environmental factors such as hot, humid, tropical, semi-arid climates are very common for ARIs to spread. And the age is mostly children's under the age of 5, and other behavioral lifestyle such as malnutrition, insufficient breastfeeding will be more causing more problems towards your ARIs.
So modes of transmission. So the 2 primary modes of transmission for ARIs are airborne and hand-to-hand direct contact of body fluids. But specifically in Nigeria, things like unhygienic practices such as coughing into your hands and then hand-to-hand contact with others, as well as the spread of ARIs through coughing and then having those tiny respiratory droplets spread is a big problem in the modes of transmission as well.
All right. So environmental and ecological factor. So our first factor are seasons. In Nigeria, there are 2 main seasons, the wet season and dry season. The National Library of Medicine conducted a study on how the seasons in Nigeria affected the number of ARI cases in children under 5. It was concluded that there was an increase in cases during the dry season. This was because of an increased amount of dust and sandstorms that were being inhaled by children, causing irritation to airways. The second factor is air pollution. In Nigeria, air pollution is a rising issue. This is mostly caused from carbon emissions that come from cars. The National Library of Medicine conducted a study on this outdoor pollution and how it affected ARI cases in children. It was concluded that children who live in heavier air polluted areas, such as near roads, are at a higher risk to get an ARI. And our third factor is biomass and charcoal. Many people in Nigeria live in poverty, so they can't afford to use stove ovens and fuel. Instead, they are using charcoal. When burning charcoal, it releases toxic fumes. So the National Library of Medicine conducted a study and found when burning charcoal for cooking or used for fuel, it causes an increase in ARIs in children and under 5. This was concluded because in most homes in Nigeria, they're poorly ventilated, causing the gases to stay in the house for children to inhale more, causing irritation to airways. Common symptoms.
Mild symptoms of ARI, such as cough and sore throat, do not require hospitalization compared to severe symptoms such as chest pains and loss of consciousness. Okay, symptoms will go from mild to severe if the ARI continues to progress, and if it's left untreated, then the complications will become harmful, such as heart failure and whatnot. So it's best to get hospitalization when you need to.
Diagnostic challenge. Accurate and timely diagnosis lead to a better understanding of the patient's health. ARI symptoms cannot always lead to correct diagnosis due to others' illnesses sharing those symptoms. Nigeria has workforce shortage, education issues, and etc. Access to the latest medical technology and most greatly improve these challenges.
Common symptoms. Some common symptoms of ARI are sore throat, cough, runny nose, and congestion. People are more at risk to get ARI when they have immune system disorders such as heart disease, lung disease, or malnutrition. ARI accounts for more than 1/3 of mortality among children under 5 years old.
Contributions to the variations in symptoms are the living environment and different populations. Symptoms that may require attention are those that can be mild initially and be overlooked for the flu. If not taken into accountability sooner, symptoms can get worse and leave long-term effects.
High-risk areas.
Factors such as poverty, rural areas, and behavior all contribute to making people the most susceptible to ARIs. For instance, children who are in poverty mostly are malnourished, and that leads them to be less immune to diseases such as ARI. Another factor is rural areas. People usually cook inside their homes and they usually do it with their children inside of the house, which causes them to be more exposed to smoke, which also leads to ARIs. And along with behavioral, again, people smoke cigarettes with their children there, which also leads them to be exposed to such harmful air.
Vulnerable populations. Some vulnerable populations include children, older adults, people with existing immune disorders, and smokers. The proportion of ARI is high and is associated with HIV infection, poor maternal education, exposure to wood smoke, and passive cigarette smoking. Impact on health and society.
So, an individual's health can be impacted by ARIs not only during the time of infection, but much later on in their life. Symptoms such as cough and sore throat can lead to much more severe symptoms such as chest pains and nasal flaring. These symptoms can have complications over time and lead to pneumonia, meningitis, and sepsis. Complications over time have been proven to show different types of diseases growing as they grow older. Dry eye disease, as well as kidney disease, have been shown to be developed in children who have had ARIs when they were younger.
Public health. Worldwide, ARIs are the leading infectious case of mortality. Contributing factors of transmission of ARI are poor air quality, colder winter temperatures, and humidity. Communities with limited access to healthcare practices, proper hygiene, and shelter are more susceptible to the disease. Vulnerability to the environment increases the probability of receiving the disease, and without proper care increases mortality.
Socioeconomic impacts. The socioeconomic impacts is very severe in Nigeria, as when people fall sick, the productivity decreases a lot. Agriculture is the dominant economic contributor in Nigeria, and especially during dry seasons, people stop working, and that causes great economic impacts. As a consequence, work productivity and work implications are reduced. Furthermore, only 3.38% of Nigeria's GDP is used on healthcare, which is significantly less than the average country in the world, especially because Nigeria has one of the highest mortality rates. A research conducted in Nigeria in 2003 to 2013 shows that 15 to 21% of kids in Nigeria suffers from incidents of ARI, and pneumonia, a form of ARI, has caused the death of more than 868,000 children. On the other hand, there are severe social inequalities and inaccessibility to healthcare, as the average Nigerian makes around $1.9 per day.
Our community workshop. Our community workshop is about educating kids about their families about the symptoms and risks of ARIs, and when we're doing them, and when to bring them to the doctor, and how ARI spreads through interactive games and activities. Our target audience is children under 5 and their families.
Parent-teacher meeting. Interactive learning is parent-teacher meeting is an interactive learning session where parents and teachers watch our workers reenact symptoms and guess if the ARIs are severe or mild. The first team with 10 points will be rewarded with plantain chips. The goal is to help people understand how ARI spreads and the symptoms.
Germ experiment. Small interactive sessions on how infections spread through hand-to-hand contact. The objective is to learn about sanitation, outcomes of ARIs, and how they spread. We will have 5 volunteers who will put glitter and lotion on their hand, and then they will shake hands and see how ARIs and bacterial is spread.
So our last exercise is called the hospital or not game. So we wanted to educate kids on different severities of symptoms and try teaching them how to identify these symptoms so they know when to go to the hospital and when it's okay for them to stay home and get treated with over-the-counter medicine. This game will split children into 2 teams where one of the LI workers will be showing symptoms, and both teams have to determine what the symptom is and if they need to go to the hospital or not. Using this game, children will be able to realize if it's truly necessary for them to go to the hospital so they can save money, time, and resources.
All right. So in total, we spent $334 and the rest will go to clinics. And here is a list. Here is a list of everything we used.
So these were some of the handouts we plan to give during our exercises. One of them shows the symptoms with small photos for children to understand. And these flyers will be placed in schools, homes, and with children so they have access to them when they need to know. And then the other one that we made was a diagram on how ARIs spread, so they're able to understand the modes of transmission and how to stop them. Thank you.
Can everyone hear her?
Okay, thank you. Yeah. Thank you very, very much for this wonderful, wonderful presentation. Transmission and symptoms. It clearly shows how deep you guys studied, how much of research you guys did. It was engaging, it was captivating. Your workshops, quite implementable, but I don't see every teacher in a school engaging in such activities, although I'm not saying it's not impossible, but there's a possibility that not all teachers will engage, which is still okay. All right. Like I mentioned, we can always start small and then move, expand or improve later. So all your ideas were good and implementable. I like the confidence you guys all had. Like I said, it shows that you guys are prepared and you have done your assignment. Well done, and have a great one, and congratulations for this wonderful presentation. Thank you. Good job, guys. Again, you all look good as well. I really liked that your presentation was definitely clear that you wanted to talk about Nigeria specifically, meaning that this couldn't have been about any other country. Like you really did your research on the Nigerian system, the healthcare sector, our policies, and your pictures are so relevant to the organization. So really good idea on that. In terms of your presentation, I would have liked if you guys were more organized. I felt like you were going back and forth and you didn't know who was next. And I'm like, hadn't you presented together before in practice? It would have been nice to see that. Apart from that, individually, you were all great. You didn't feel like you needed to read every single thing on the slides and you were talking to your audience, which was great. So it was possible for us to follow. In terms of your activities, I did like most of them. My only issue with the activities, what some of them anyways, was in terms of like how you can take them beyond the workshop. Because like we have talked about the fact that just giving information is not enough for behavioral change. And what you want is for people to change. I know that you had the handouts, which is cool, but it would have been nice if you also wanted to move your games, like the germ games, beyond just your workshop to also give like glitters out as well and to kind of make it a part of thing that maybe they do every Friday. They do the glitter germ game and you wanted that game to be something that all the other schools are doing so that your information goes way beyond your workshop. Your handouts were very pretty. It was nice. And just like Aisha said as well, concerning the PTA, again, that is just more like an information session. So all the time, think about like, if I leave this room, would they still know what I taught them? Odds are no. So if I leave this room, how can they remember me? But you all did a good job. You should feel really proud of yourself. Your hard work was so clear on your slides. I'm pretty sure you know the same terms. You're kind of like ARI experts now in Nigeria. Well done.
Hello, guys. Excellent job again. I'm so proud of you all. I like the presentation, the games, and your composure as well. That's great. Just when you guys were mentioning challenges for ARIs in Nigeria, you made mention of stigma. Just to correct that, stigma, I don't think we have any issue of stigma with ARIs. Yeah, man, nobody will like stigmatize you like you have TB or you have HIV, for instance. Okay, so that's very after then. Then you also like you to add the issue of vulnerable groups. In Bauchi, we have children and women and even men who are internally displaced because of conflicts, especially insurgency in the state and neighboring states. So many people are living outside homes in open space without shelter and anything. So therefore, they should be part of the vulnerable groups. Thank you. That's all. Well done, guys.